We're joined once again by Bob Garrett, who is the CEO of Hackensack Meridian Health, which is in fact an underwriter of our healthcare programming. Bob, thank you for joining us.
Great to see you, Steve.
Bob, we've talked about COVID from so many perspectives, and if I'm not mistaken, HMH, I believe, had one of the first COVID patients back in March 4th, was it, 2020?
That's correct, Steve. March 4th, 2020, the first COVID patient in the state of New Jersey was being cared for at Hackensack University Medical Center.
Part of the HMH system, 17 hospitals, 36,000 employees. Bob, let me try this. Last time we talked, I wasn't able to get into this with you, but I do want to now. The nursing shortage. I know your nursing team well. The physicians I work with and I teach, and I said I teach in the Physician Leadership Academy at HMH, they're so reliant on those nurses. I don't like saying how bad is it, but Bob, how bad is the nursing shortage, A, and B, what options do you and other healthcare leaders have in dealing with it directly to help the patients at HMH?
Yeah, so staff, is short, where it's tight. There is a significant nursing shortage. There was one before we got into the Omicron surge, and of course that made it even worse as nurses, unfortunately, did contract COVID and were out for a period of time. So, what we've done at Hackensack Meridian is we have had to hire additional staff through agencies. We've actually hired over 1,000 RNs, nurses, to supplement our regular nursing team members.
Is that more expensive, Bob?
I'm sorry?
Is that more expensive?
Much more expensive, Steve. So, there are nurses out there, agency nurses that are being paid even $250, $300 an hour in places like California, and not that far behind that in New Jersey. So significantly more than what we've seen in the past. But honestly, at this point, we want to make sure we have the appropriate number of caregivers, particularly on the front lines fighting COVID. So we've taken that step to hire those people. We've also reassigned nurses from other activities. If they weren't doing direct patient care, we've been able to restructure, reassign. As the COVID surge continued, we were able to, as an example, reschedule some procedures and surgeries that were not time sensitive. And those nurses and other team members that were working in those areas were reassigned to the front lines. We've also reassigned through our workforce reassignment office at Hackensack Meridian. We've reassigned about 450 team members, some of them being nurses, to the front lines. So these might be nurses who are working in research positions or in academic positions, but certainly have the clinical skills to help their colleagues on the front line, and we have reassigned them for those purposes. So we've really put together a comprehensive strategy to be sure that staffing is at good levels throughout Hackensack Meridian Health.
Bob, well, I need to try this one. How the heck does healthcare and science and decisions about vaccines, which people could debate whatever they want, but you and your colleagues, particularly those on the front line, know that those are the sickest in the ED, the ER, are those who are not vaccinated. Question, how the heck has healthcare become so, I'm not going to pull you into a political discussion, but how the heck does it even become political?
Steve, it shouldn't be political at all. In my view, this is basic. I mean, the science is there. Vaccines have proven to be effective. Now, some people might say, well, look at all the breakthrough cases, because of Omicron. Yes, that's true. But look at
yes, we're taping at the end of January. We're praying this airs after that. It's not as bad, but there may be a new variant. We don't know. I'm sorry, Bob. Pick it up from there.
We don't know. You're absolutely right. But yes, there have been breakthrough cases because of that have broken through the vaccine because of a particular variant like Omicron. But if you look at the severity of those patients, they by and large have not been hospitalized, and even those that required a hospitalization, it was a relatively short stay. Very few of those people who were double vaccinated and boosted ended off in our critical care units or ended off on a respirator or even worse, passed away as a result of COVID. So yes, the vaccine has been effective. The science has proven it. I think without the vaccine, from a global perspective, we would be in really, really bad shape right now if it wasn't for the vaccines. So this should not be political, Steve. This is pretty basic. But look we're a health system. Our responsibility is to the communities we serve, and we're not going to not treat a patient that hasn't been vaccinated. We have to treat all patients. But I would urge, to the people that are viewing your show, if you haven't been vaccinated yet, please get vaccinated. It does work. If you haven't been boosted and you're eligible for a booster shot, please get the booster shot. It does work. It does make a difference.
Bob, before I let you go, we had you on a while back with the great, you remember, right? Harry Carson?
Yes.
You and Harry Carson came on. Harry Carson, the great New York football giant. I believe he's in the Hall of Fame. He is. And also HMH directly, if you watch any Giant press conference praying after a win next year, you'll see the HMH logos all over the Hackensack Meridian Health. I remember you and Harry Carson came on to talk specifically about vaccine resistance in the African-American community. Now, that was a while back. What progress, before I let you go, Bob, what progress have we made in that regard? A, and B, what do we still need to do?
Tremendous progress has been made in really vaccinating the underserved communities. We work very collaboratively with community organizations, with churches, and the gap that was once very wide between the vaccination rates of people of color and their white counterparts has closed significantly. We're not 100% there yet. There's still work to be done, but through the great work of people like Harry Carson and others, that gap has really been closed significantly.
And really, before I let you go, in all seriousness, lifelong Giant fan?
Lifelong Giants fan. I'm still proud to admit it.
Even when we lose, you stay. That's loyalty.
Yeah, I do stay with it. I can't say I'm not frustrated by it. I'm always thinking optimistically. I'm an optimist by nature, Steve. So I'm thinking 2022, it's got to get better.
I also happen to know Bob's Catholic, so he may be doing a novena. Not everyone may appreciate that, but I know he will. Hey, Bob Garrett, who's the CEO of Hackensack Meridian Health. Thanks, Bob.
Thank you so much, Steve. Great to see you.
We'll be right back.
One-on-One with Steve Adubato has been a production of the CAUCUS Educational Corporation. Funding has been provided by Delta Dental of New Jersey, Investors Bank, New Jersey Sharing Network, IBEW Local 102, PSC&G, Fedway Associates, Inc., Johnson & Johnson, the Healthcare Foundation of New Jersey, and by the Port Authority of New York and New Jersey. Promotional support provided by the New Jersey Business and Industry Association and by New Jersey Globe.
Hi, I'm Joe Roth. In New Jersey, there are nearly 4,000 residents in need of a life-saving organ transplant, and one person dies every 3 days waiting for this gift of life. One organ and tissue donor can save 8 lives and enhance the lives of over 75 people. You have the power to make a difference and give hope. For information or to become an organ and tissue donor, visit www.njsharingnetwork.org and be sure to talk with your family and friends about this life-saving decision.